Alrighty, from Macomb City Hall, hello, this is Macomb Mayor Mike Inman. It is the 23rd day of April 2021 with an update on the COVID-19 pandemic here in Macomb and McDonough County. Kind of following the same format we followed here for quite some time, giving you some information that predominantly is from the McDonough County Health Department. So we'll start off. There seems to be a trend of about 6, 7, 8 cases, and that's in a general term, that are new cases every day. It seems to be sustained at that level. If you remember, a month or so ago, we were reporting some days with little or no new case activity. So as of today, late yesterday, I apologize, the most recent case count was 2,608. They were reporting an additional half a dozen or so cases from the previous day. Kind of the thing that is telling is the number of active cases that are currently in the county, and that's, as of yesterday, 71. So 71 active cases. And then across the region, that IDPH region that we've talked about in the past, the numbers seem to be kind of steady, both the number of hospital admissions, COVID cases. What we are seeing an increase in is vaccinations, and we'll talk more about that here in just a few minutes. But the idea is that we, in order to start into the next phase of phase 5 and get where we all want to be, we need to see a decline in hospitalizations, trending decline in overall reported positive cases of COVID-19. And we're meeting some of the other metrics, again, relative to vaccination. So let's talk about that a little bit. Currently reporting 16,700 and almost 50 total vaccines given in the county. That would be folks in the county who have received at least their first dose of the COVID-19 vaccination, maybe both, but at least one. And the total number of people vaccinated in the county that have 2 doses is just under 7,800, 7,797 to be exact. This is where we continue to have some concerns about people still needing to be vaccinated, maybe in some cases very much wanting to be vaccinated, but have been hesitant or reluctant over the last several months about getting vaccinated or knowing how to get vaccinated, or the process was cumbersome. We completely understand that. As recently as earlier this week, the McDonough District Hospital held a mass vaccination clinic. It was this past Tuesday, where they vaccinated about 180, a little more than that, people. And the one thing that made that so successful, I believe, was that they opened that up to walk-ins. Didn't have to have a pre-arranged appointment time or anything else. And what I'm sensing as we move forward is that I'm going to give you some information from the health department here in a few minutes about one of their open walk-in clinics. And I think that is what you should be prepared to start looking at, where there is no pre-registration, at least generally speaking, and their ability to openly and readily get it at an opportunity to be vaccinated. Still waiting on some direction from the CDC regarding the Johnson & Johnson vaccine. None of these clinics that are operating now, and since the Johnson & Johnson was put on pause by the CDC and the FDA, that vaccine has not been used. This most recent clinic was Pfizer vaccine by the hospital. And this one clinic we're going to talk about here in a minute, coming up the first of next week, by the health department, is also Pfizer. So Pfizer and Moderna have been the predominant vaccines that have been utilized here in Macomb, McDonough County, the state, and quite honestly, the country. But again, what we'd ask you to do is reconsider if you had decided maybe you weren't in line yet or hadn't had an opportunity to make this a priority in your life to get vaccinated. We'd ask you to reconsider that now, as the availability for vaccine is fairly widely available. There's no necessary pre-appointment, no getting online, you just show up. So, and then those of you that may be watching this that can encourage other folks in your sphere of influence to get vaccinated and reassure them that it's safe, that if you've been vaccinated, tell them about your experience, and we hope it's been a positive one, knowing full well that there's a wide variety of experiences that have been had by people who've gotten vaccinated. But really, we're at that juncture right now where until we can get a steady decline in reported cases and an increase in vaccinations, I'm just afraid we're going to be in a position where we still don't want to be. We want to be moving forward into that pretty much unmitigated phase 5 of the Restore Illinois plan. So the most recent information we have from the health department about one of their vaccine clinics, that's coming up this coming Monday, the 26th, 9 a.m. until whenever. It's a walk-in clinic at the McDonough County Health Department. The health department website is available on your screen now. You can get the information there. We share that with you only because it's an information sharing tool. You do not, I repeat, do not have to pre-register for this clinic or get an appointment. It's just not necessary at this time. It's a Pfizer vaccine you'll be given, and it's available to the general public, no restrictions, except they have to be over 16 years old. So Pfizer COVID-19 vaccine this coming Monday, the 26th, 9 a.m. until, it's got a question mark here. Location is the McDonough County Health Department, 505 East Jackson Street. If you have a photo ID, that would be helpful. You bring it in, they can fill out the paperwork much more quickly if you have a readily available photo ID to operate off of. And again, the health department's website, website information is at the bottom of your screen now. And I would also ask you to keep checking that periodically, even after next Monday. We're going to do our best. All the partners in the community are going to do their best about announcing when these COVID vaccination clinics are popping up, so to speak, so there won't be a lack in getting information out. It's going to be us working collectively, collaboratively to share that information with the public. So you, if you're on the health department's website, it should be available. It'll be promoted on city websites and social media, cross-promoted on health department, McDonough District Hospital websites. No matter where the clinics are going to be at, we'll make sure that the other entities, the other partners in the community are sharing that information widely. And then if you could do us a favor and share that with folks that you share stuff with on social media or by phone or by word of mouth, whatever the case may be. Because it really is going to take us all working together to increase these vaccination numbers so that we can move forward. Again, there have been some additional deaths since we talked last. I should have mentioned that earlier. Again, our sympathies, condolences go out to those families who have suffered a loss during this pandemic due to COVID-19. For those folks in the restaurant community, we'd like to remind them that there are grant availability through a new program through the state, and we're getting that information out with our community development, economic development partners through the Macomb Area Chamber of Commerce, the Macomb Area Economic Development Corporation, or Downtown Development. So those websites are listed here. So if you're a restaurant business owner, there's opportunity for you to get more grant money available to you. They will walk you through the process. There's a number of webinars that are available, and that information is available, and we'll post that at the bottom of your screen now. So if you have any questions, please reach out to the health department, the hospital. We'll be happy to try to field your questions or get you information or send you in the right direction if you reach out to us here at the city at the end, in any of the offices listed at the end of this video. So again, the word now is vaccinate, vaccinate, vaccinate. It's widely available. We need your help in spreading the word and encouraging folks to do what we need to get done to move us forward. And again, if you have any questions, please feel free to reach out. For now, we'll talk again soon. Thank you.